Towards the end of your dog's life, habang tumatanda yung inyong mga aso, you might notice that they are exhibiting signs of, excessive lacrimation, may matindi magmuta, minsan to the point na hindi na nila maimulat yung mga mata nila. So, they may be having what we call the dry eye syndrome. What is dry eye syndrome? We are going to discuss that today. Welcome back, guys. My name is Dr. Stresho. I'm an animal doctor, and every week we post videos, cases, topics, and tips on how to better take care of your fur babies. And this week, we are going to talk about the dry eye syndrome, or yung tinatawag usually naririnig natin as KCS, or yung keratoconjunctivitis sicca. Technically, the disease is known as keratoconjunctivitis sicca. It is the result of inadequate tear production. So, ibig sabihin, kulang yung production ng luha dun sa mata niya. Usually, it's a lifelong and progressive disease. Kung hindi magamot, it causes constant discomfort and progressive damage to the surface of the eye. It occurs in approximately 1 out of 100. So, mababa lang naman occurrence, but lately, parang madami ako nakikita niyan na mga ginagawa natin. So, ano bang nangyayari? What are the consequences of eye syndrome? Yung tears kasi, it has multiple important functions to protect the surface of the eyes. Number 1, it provides lubrication, nutrition, growth factors, antibacterial defense mechanisms, and it provides a physical cleansing action. Kaya kung halimbawa, napupuwing tayo, na may napunta sa mata mo, ang initial reaction ng mata mo will be to produce tears because it wants to take that dirt or that dust or that speck of dirt in your eye, no? So it goes without saying that inadequate tear production results in inflammation and damage to the surface of the eye. Initially, the surface of the eye becomes dehydrated and roughened. Kapag kulang na yung luha, madi-dehydrate siya at gagaspang. And it will become thin. Lalo na kapag, so syempre, wala na masyadong luha, tapos increase in friction from the blinking of the eye causes scratching and ulceration of the surface. This can expose nerve endings which can cause substantial pain. Over time, yung constant inflammation of the surface of the eye causes permanent changes that affects vision. No? Nagkakaroon ng thickening there, no? Nagkakaroon din ng blood vessel ingrowth, fat and calcium deposition, and pigmentation, scarring across the field of vision. So, parang lumalabo yung paningin yung dogs natin. So, kung untreated naman, if you do not treat it, if you leave it untreated, yung dry eye syndrome causes constant pain and can progress to complete and irreversible vision loss. Mabulag. So, how do we diagnose dry eye? Madali lang yan. We measure a dog's tear production using a Schirmer tear test. It is a simple test performed in the consult room. Ganito yan. Yung length of filter paper is placed on the eye with one end sitting inside the lower eyelid and the remaining strip sticking out. Ganyan. So, this is left in place for 1 minute. For 1 minute, we measure how far the tears have traveled down the paper. In a normal dog's eye, the tears should have traveled 15 minutes or more. A result less than this indicates inadequate tear production. The lower the result, the more severe the disease. Tear production less than 5 millimeters per minute indicates severe disease. Inadequate tear production can lead to damage to the surface of the eye kasi nga walang lubrication, frequent friction on the eye, no? So, kailangan din natin i-measure kung meron siyang butas na. Hence, we do fluorescent stain to assess the condition of the eye, no? How do we do that? Simple lang, ganito lang yan. Yung fluorescent stain sticks to the areas of the eye surface that are damaged. There may be generalized or very faint staining of an unhealthy eye surface, or a more intense staining in areas where there is deeper damage, no? So kung yung stain will stick to the area kung saan merong damage, no? Kung mas malaki o mas maliit. And an ulcer, didikitin siya if an ulcer has formed. Ano nga ba? What causes inadequate tear production? Bakit mababa yung pag-produce ng tears? So, dry eye syndrome is generally considered an immune-mediated or autoimmune disease. Ibig sabihin, yung dog's immune system starts attacking itself, destroying the structures involved in tear production. No? So, the disease is generally considered idiopathic. Ibig sabihin, hindi natin alam kung bakit nangyayari yun. No? Why the body suddenly starts doing this, we don't know. Sometimes, the dry eye syndrome is part of a wider immune system disorder. May iba siyang sakit na kailangan natin na-address and may be combined with other immune-mediated diseases. Such as, halimbawa, lupus erythematosus, systemic lupus erythematosus, pemphigus foliaceus, rheumatoid arthritis, hypothyroidism, diabetes mellitus, polymyositis, atopy, glomerulonephritis, or ulcerative colitis. But, more often, dry eye syndrome occurs by itself. There are other less common causes of dry eyes. Ano yung iba dyan? Drug-induced. Certain drugs like yung mga sulfa drugs, sulfa, yan, can be toxic to the tear-producing structures and can cause temporary or very rarely permanent reduction in tear production. So pag nawala yung gamot, bumabalik na rin yung tear production. Surgery. Halimbawa yung diniscuss natin, yung cherry eye, ayan, ibang doctors kasi tinatanggal yung third eyelid gland, which is responsible for 30% of tear production sa mata. So damage or removal of the third eyelid gland can cause dry eyes. So huwag niyo ipapatanggal yan. Okay? Diniscuss natin yan dito sa topic na to. Okay? Panoorin niyo yan. Alright? Ayan. Number 3 is eye trauma. So, trauma to the eye orbit. Halimbawa, na aksidente, na nabagsak, o kaya nahampas yung aso, o kaya from a dog fight. Basta trauma to the orbit of the eye can damage the nerves, can affect the nerves involved in the tear production. Hence, bumababa yung tear production. Neurogenic. Ano yung neurogenic? Dry eye may occur with dysfunction of the facial nerve. Pag mismo yung facial nerves yung affected, ayun, hindi siya mag-produce ng tears. Congenital, rare yan, yung mga puppies such as yung miniature breeds, such as pugs, chihuahuas, Yorkshire Terrier, may be born without working tear structures. Very rare naman to, but it happens. No? And there are certain breeds that are more prone to this condition. No? Halimbawa, yung Cavalier King Charles, Spaniels, yung English Bulldogs, Lhasa Apso, Shih Tzu, West Highland Terriers, and Pugs. Question, kailan ba natin una nakikita itong dry eye syndrome? When do they occur? First, so dry eye syndrome can begin at any age. No? Any age yan, pwede natin makita depending on the cause that we mentioned earlier. No? But the incidence of dry eye syndrome generally increases as they age. Habang tumatanda yung aso, mas nakakita tayo, mas napapansin natin na nagkaka-develop sila nitong mga dry eye syndrome over time. Some cases of dry eyes are very mild. Yung hindi mo halos mapapansin and are intermittent. Isa nandyan, isa nawawala, especially the early stages of the disease. In such dogs, other factors also contribute to when dry eye symptoms begin or worsen. Halimbawa, yung bulging eyes. May mga brachycephalic, mga pangong aso na luwa talaga yung mata nila. No? So, nakaka-contribute yun sa development ng dry eyes. No? O kaya yung squash of face, talagang simangot yung mukha niya, talagang pangong-pango yung ilong. They may suffer sooner or more severely because they also suffer from excess loss of tears due to increased evaporation of tears from the surface of the eye. Kasi nga, bulging na yung mata niya mas exposed sa air. No? Isa pa, yung sobrang dry ng environment with heavy heating. Sa ibang bansa yan, yung may winter, no? may heater all over the house. No? Yan, nakaka-contribute yan. Or, dito sa atin sa Pilipinas, yung air conditioning, yung masyadong malalimig naman yung bahay, this can also cause dehydration and can lead to decreased tear production. Tear production also naturally decreases with age. Habang tumatanda tayo, all of us, even humans, no? Habang tumatanda tayo, yung production natin ng luha sa ating mata, mas kumakaunti na. Kaya mas prone din yung mga matanda na. Kikita ko sila pahid ng mata niya. Kasi nga, kumbaga, sabi nga ng matanda, nauubos na daw yung luha nila. No? Even in dogs, especially yung mga dogs na 10 years and above, you would notice mas madalas sila magmuta. Yung talaga muta, nagkikik talaga sa mata nila. No? And the tear structures deteriorate with aging. Thus, a larger number of older dogs show dry eye symptoms or suffer more severely. Makikita mo din na meron siyang pain and squinting. Sakit yung mata niya, no? Dry or dull appearance to the eye surface, parang hindi na kumukuti-kutitap yung kanilang mga mata, no? Napapansin yan kapag tumatanda. Meron din mild and mucus discharge, more prominent blood vessels and redness across the whites of the eyes. Kaya tawag natin conjunctivitis, and more prominent reddened conjunctiva or pink under the eyelids. Makikita mo pala. As the disease progresses, constant inflammation of the surface of the eye causes further changes and damage. Later symptoms with prolonged untreated disease include a thick, ropey discharge that clings to the eye. Parang may uhog doon sa mata. Dried up discharge on the eyelids causing the eyelashes to stick together. Dikit na halos hindi sila makamulan. A white haze across the surface of the eye. Fine blood vessels growing across the surface of the eyes, or dark pigmentation across the surface of the eye. Gray scar formation over the surface, no? And sometimes an ulcer may develop on the surface of the eye kapag talagang napabayaan. At any stage in dogs with dry eye syndrome. So eye ulcers are painful. Konting-konti lang na magkaroon tayo ng sugat sa mata, napakasakit din yan. Ulcer can cause sudden increase in squinting or holding the eye closed, as well as rubbing the eye with the paw or on the ground or on the sofa. Yan. So yung deep ulcers naman can potentially cause the eyeball to rupture. Kapag hindi sila nagamot, pwedeng mabutas yung kanilang mata kasi desmetocin. Meron din tayo isang topic na yan. Tignan nyo dito. No? Eye ulceration. Sundan nyo, panoorin nyo yung topic na yan. Yung sudden increase in squinting requires prompt veterinary investigation. Dalhin nyo na agad yan sa vet. Adi may foreign body or may corneal ulceration. No? Ngayon, pag-usapan na natin, how do you treat itong dry eye syndrome? So dry eye syndrome is usually treated with specific lifelong eye medication. Used fastidiously, such medication is generally quite effective at increasing tear production and reducing symptoms. Ano yung mga yan? Cyclosporine, tacrolimus, yung mga yan. Yung cyclosporine or eye ointment is one of the most common treatments used. And iniisip ko, yung cyclosporine kasi may immunosuppressant effect yan. It works by reducing the body's attack to their structures, allowing them to regenerate. It also directly stimulates tear production and reduces pigmentation and blood vessels growth over the surface of the eye. Yung tacrolimus naman is another eye medication that may be used. It works similarly with cyclosporine and is preferred by some ophthalmologists because it is more potent. However, mahal, harder to source, and must be handled with care by owners due to potential toxicity. Ayan ha. So, wag basta bibili. So, narinig nyo, sinabi ko, baka mamaya punta na kayo sa drugstore, bili na kayo ng mga drugs na ito. No? So, wag. Because may mga requirements tayo dyan. You have to be diagnosed first. These drugs must be prescribed by your vets. No? So, before applying any eye medication, the eye should be cleaned muna. Meron tayong mga eye wash na inalagay yan to take the muck using a moist cotton ball. No? Cyclosporine or tacrolimus eye medication is applied 2 to 3 times a day, and it can take up to 6 weeks for tear production to return to normal. Kailangan babalik kayo sa veterinarian nyo every 2 weeks to measure kung nagpuproduce na nga ba tayo ng tamang tears dun sa mata, kung bumalik na. In the early stages, artificial tears may be used every 2 to 4 hours while waiting for the eye medication to increase tear production or where it is not 100% effective. If there's also a bacterial infection or other ulcers in the eye, antibiotic eye medication will be needed as well. Once the tear production has returned to normal, the artificial tears can be stopped, and some dogs may be able to get by on cyclosporin drops given once a day only, or once a day na lang yung medication. However, most dogs need to stay on twice daily eye medication for life. And where the specific eye medication are ineffective, surgery may be performed. Kung hindi talaga kaya ng mga drugs, may surgery tayo for this, but mataas ang failure dito, no? Surgical correction is rare, as most cases naman is effectively managed by eye medication, eye ointments natin. So ano yung prognosis? Untreated dry eye syndrome often progresses to scarring, pigmentation, and blood vessel ingrowths across the surface of the eye that can lead to complete vision loss. Most patients respond well to cyclosporin and tacrolimus eye medications, but they need to be continued lifelong. Pag tinigil nyo yan, yung stopping medication causes the tears to dry up again and symptoms to return. Some dogs, especially those with virtually or no remaining tear production, sa Schirmer tear test results, may not respond well at all to the medication. Some types of damage to the surface of the eye are irreversible. Yung mga ganyang klase. Yung cyclosporin may reduce surface pigmentation. That has occurred by about 80%. Pero, where there is significant damage to the surface of the eye, some scarring, pigmentation, and blood vessel ingrowth will likely always remain. Early treatment offers the best chance for preventing vision loss. Again, this has been your friendly neighborhood veterinarian, Dr. Stresho. I hope to see you again next week.
Yung pigit-pigit.